Good morning. I'm Dr Toby Coates. I'm the President of the Transplantation Society of Australia and New Zealand. And I've been asked to help make some videos by Transplant Australia in collaboration with our friends at the Transplant Nurses Association and generously supported by Astellas, the pharmaceutical company, to sort of give a bit of a guide to what you can do to try to stay healthy during this current pandemic. We know it's a very worrying and disturbing time for everybody in the transplant community, and the transplant professionals are critically aware of the issues that are there for our patients. So I felt I'd perhaps first start by explaining why I'm sitting here inside this in this car, sort of socially isolated. This is my 1959 Morris Minor, to which my wife will always say it's a good place to be isolated because nobody wants to have anything to do with it. But on a more serious note, I guess the most important thing that I can recommend for everybody out there is the current social distancing and personal hygiene things. In particular, try and avoid as much contact as you can as a transplant recipient or just a general member of the public. Try and be by yourself as much as you can, within safe limits, of course. So keeping that social distance is important. Washing your hands whenever you possibly can is another really important thing that you can do. If you can't get hold of the alcohol, just wash them with soap and water. The virus is dissolvable, it's got a coat of fat around the outside of it, and the soap that you have, just general ordinary soap, is quite effective at getting rid of it. So you don't need all those fancy things. If you can get the alcohol-based wipes, well, certainly please use them. They're good. So I think social distancing and keeping away from people as much as you can is the core of what we need to do, because if you don't catch the virus, then you don't have to fight it off. Now, of course, we know transplant patients have got immunosuppression, and that's one of those issues. That's what we need to do for the transplant. But of course, most people, when they're several months or even years down the track, the immunity levels actually get very close to back to being normal. So there's not actually that much more risk. Having said that, let's not take any chances and keep everybody as safe as we possibly can by doing these social distancing things. So there are a few other issues I think that are important that people ask me, and I think the most important thing to say is the best advice for you will come from your team, from your nurses, from your doctors, from your hospital. So whatever you read on social media, whatever it is, take it with a pinch of salt. Your doctors, your team will give you the best advice and the most appropriate advice for you. So we're quite deliberately being very general in what we're saying, and we don't really want to give specific advice because it won't be right. Everything should be tailored for the individual. But there are a couple of things I think that can help make life a bit easier. Firstly, many of us professionals, medical doctors and nurses, are now switching to telehealth, to being able to catch up with our patients. And that's actually a really good and positive initiative, I think. And I suspect when this is all over, we'll be doing a whole lot more of this. For example, I did a clinic on Friday, which was my Mount Gambier clinic, but I did it from Adelaide in my consulting room. And it was actually fantastic because I caught up with a couple of my transplant patients who were farmers, and they were out on their tractors, so I could actually see what they were doing in their real everyday lives. And I think going forward, we'll probably end up doing more of that rather than less of it. But a couple of things you can do if your doctors are going to do telemedicine to help them out will firstly be make sure you've got a list of your medications so that they can check with you exactly what you're taking. Secondly, if you've got a blood pressure cuff at home, do your blood pressure. That's the sort of thing that they'll want to know. Likewise, if you can do your temperature, you can do your temperature. And your weight. They're sort of practical, easy things that you could do to help a telemedicine consult go along a lot faster than otherwise, and catch up with your healthcare professionals that way. The second question that people often ask is, well, should I be stockpiling my medications? And the answer to that is, well, probably no. I always think it's a good idea to have, maybe 2 months of medication on hand, and that's just general sort of standard practice. But every hospital and every jurisdiction is going to be slightly different. But as far as we know, there really isn't any problem in terms of supply of medications for people in Australia. We have excellent supply lines. There shouldn't be any problem with things running out, and certainly the big hospitals with which you're all transplant affiliated with will have supplies of everything that you could possibly need. So I don't think that's a thing that you should necessarily worry about. And I guess finally, what does social isolation mean? My wife is very happy to send me out to sit in the shed or sit in the car. that's certainly something that you can do. We don't really want to be driving around and interacting with other people, but there's always plenty of things that you can actually do at home. One of the interesting things that we've discovered just recently, getting something back from our kids for a change, was one of these music services called Spotify. So my wife has spent a lot of time compiling interesting playlists of songs appropriate for the times to listen to. So that's just something that she's otherwise doing. And I certainly recommend catching up with people over the telephone. FaceTime's a great thing. Any of these apps where you can actually visually catch up with people. And you know, some of my patients in Mount Gambier have been having virtual coffee mornings and that sort of thing. And obviously you could do dinner or any of those other things to help pass the time away. We will certainly all get through this. There's a series of great videos that are going to be made by amateurs like myself. So apologies for all my umming and ahhing. I would point out we'll hopefully get an exercise physiologist and a few other practical people to come and give some advice. And remember, everything is generic. It's not specific for you. And stay strong during this time. Keep that social distance, and take care of yourselves and all of your friends as best you can. And check in with the Transplant Society of Australia and New Zealand, the TNA, of course, and very much grateful thanks to Transplant Australia and the support of Astellas to make these sort of initiatives possible. So with any luck, I will see if the car will start. And look at that, beautiful. But you know what? I'm not going anywhere, so I'll turn it off. Thanks.